Thank you and good afternoon. So we've had another big day today where we've had 1,068 new cases of COVID-19 in British Columbia, 33 of whom were epidemiologically linked cases. So that brings our total to 105,988 people in British Columbia who've been diagnosed with COVID-19. Of the new cases, 352 were people in the Vancouver Coastal Health region, 492 were people in the Fraser Health region, 73 people on Vancouver Island Health, 106 people in the Interior Health region, 43 people in the Northern Health region, and 2 were new cases in people who would normally reside outside of Canada. We have now 328 people hospitalized with COVID-19, 96 of whom are in critical care or ICU. Over the last day, we've had another 3 people who've died from COVID-19, 2 in the Vancouver Coastal Health region and 1 in the Island Health region, bringing the total number of people in British Columbia who've died to 1,489. And as always, at this trying time, our condolences and our thoughts go to the families and the caregivers and the communities who mourn their loss. We've had no new outbreaks, and we now are down to 3 active outbreaks, 1 in long-term care, 1 in assisted living, and 1 in independent living, and 9 in acute care. To date, we've given 912,056 doses of all of the COVID-19 vaccines in BC. 87,474 were second doses. And today, we had our Get Vaccinated online vaccine registration and booking system, which started early this morning, and I know we'll have more to say about that. But this means you can pre-register, and then when your age eligibility comes up, you will automatically be contacted to book your appointment, either online, by phone, or in person. And as of today, people 71 and older, and Indigenous peoples 18 and over, and people who have their letters around clinically extremely vulnerable may book appointments. As you know, in addition to our age-based program, we continue to immunize in some of the high-risk workplaces, though our parallel worker-focused program remains on pause right now as we are continuing to get more information about the AstraZeneca and Covishield vaccines, where we talked last week the safety signal that was detected in Europe. There's more discussions with the experts going on internationally, even as we speak, and the European Medicines Agency and Health Canada is involved with these discussions. We're hoping to have some more information about that very soon. In the meantime, we will be using the AstraZeneca that we have in BC to advance the age groups that are eligible for vaccine, and we've heard good news that we might be receiving additional vaccines with the Johnson & Johnson or the Janssen vaccine being available sometime near the end of this month. And as soon as we have the ability, we will jumpstart our worker program once again. So please be patient. We know that there's always challenges that we have with our immunization program, with the immunizations arriving, and we will be getting back to the worker program as soon as we possibly can. One of the most concerning things that we've been following over the last little while is the variants of concern. And with the latest testing, there have been another 207 confirmed COVID-19 cases that are variants of concern in the province. All but one of these was in the Vancouver Coastal Health region in the last little while, 1 in the Fraser Health region. So that brings the total of cases that are the variants of concern to 3,766. It is important to note, however, that of the total cases, these 3,700 and some, we now have only 266 which are active cases. So that's about 3% of our active cases right now. So that tells you a couple of things. One, that there's a time delay before we can confirm that a specific variant is causing illness in people. And that is important because we take the same measures for every single case that's identified, because we cannot know immediately whether there's somebody who has a variant or not. And that has been what we've been doing in public health since the emergence of the understanding that some of these variants were coming or were here in BC. I will also note that we have of the people in hospital right now, 63 of them are people who have been identified as having one of the variants of concern, primarily the B117, which is 42 of the 63 people in hospital right now, and that's about 13% of our hospitalizations. 20 of the people in hospital right now are people that we know have the P1 variant. That's about 6% of people in hospital right now. And there's one person that we know with the B1351, which is the South African variant. So that gives you a sense of the proportion of people that we know have these variants of concern. So far, it is the B117, the UK variant, that is dominating what we're seeing now in British Columbia. It's not the most common strain that we're seeing, but of the variants of concern, it is the most common, with 2,838 people identified carrying this strain. 51 people with the B1351, the South African strain, and that has mostly died down. We have not had new cases of that for a little while. What we have seen, though, is an increase in the last few months or few weeks of the P1 from Brazil. So this is a strain that we are testing for, screening for, and doing whole genome sequencing. And we now have 877 confirmed cases with this P1. 106 of them are active cases, so about 1% of these cases, 1.2%, are now active. Again, about 2,500 of all of the VOCs are people who live in Fraser Health, and that's just up by one right now. 1,128 are in Vancouver Coastal, and that's up by 206. And the majority of the P1 that we're seeing in BC are people who reside in the Vancouver Coastal Health region, primarily part of them in the lower mainland part of Vancouver, and a good proportion in Whistler. About 197 are people of the several thousand, the little over 1,000 people who've been identified as having COVID-19 in Whistler, so a small percentage. And about 20 of the cases are on Vancouver Island, 103 in the Interior Health, and 15 in Northern Health. So when we look at these variants of concern, we've been following them through our laboratory surveillance since the concern first arose, and we watched what happened in the UK. And what we know is that viruses, by their very nature, mutate and change. And as more transmission happens, if there's more virus transmitting, it means it's changing, it's replicating more often. The opportunity for these spelling errors or mutations to occur goes up. And we saw them. That's why we see these variants arise where there's lots of cases happening in the US, in Brazil, in the UK, for example. Sometimes a mutation, so a spelling error, will occur. A competitive advantage, and it will spread faster and take over transmission. And that's what we saw in the UK, and that's what we're seeing here in BC and in other parts of Canada. And for us, it's the B117 strain that seems to have that competitive advantage and is taking over. Since the beginning of the pandemic, we've seen several variants that are more common. And in the last 2 months, it's the B117 that's taken over about a third of our cases. But we expect it will continue to increase. And we know we've seen that happen, that when it gets that competitive advantage, it can spread more easily. It's the one that tends to increase more rapidly. We've seen in Ontario that now it's about 60% of all of the new cases are with the B117 strain in Ontario. And we're probably a month or so behind Ontario in getting there. We know that this happens. It's the way that viruses evolve over time. We've seen as well that we've done a lot of testing for variants in British Columbia. We've had a strong whole genome sequencing program where we it very early on, and we've presented that data from the very beginning, where we had cases that we could associate with China, with Iran, with Washington State, and we've been following this for some time. And the variants that we've seen most commonly are ones called B112, and now we're starting to see other ones come as well. We've also done whole genome sequencing in over 19,000 specimens, and so that's way more than most countries in the world. So the numbers are higher here. But the percentages are increasing at a similar rate that we've seen in other countries and other places in the world. So we also are doing screening of over 90% of the positive cases that happen every day. So there's a second test, a screening test. It's called a single nucleotide polymorphism test, or a SNP test. And it looks for some of the common mutations that help us identify if it's one of those variants of concern. So the changes that we think make the virus transmit better. And these are things like the N501Y, which is one of the parts of the spike protein, and the E484K, which is also part of the spike protein that we think gives this advantage that they can attach better. But we need to confirm these screening tests with whole genome sequencing, and that is a much more involved process that can take several days. So sometimes we'll get a screening positive, but it'll turn out not to be one of the variants of concern. It may be another variant that is carrying that similar mutation, and that's important for us to know as well, because it is a very real possibility that other variants will arise, or other mutations will give another strain of this virus some competitive advantage in the future. So the whole genome sequencing tells us that there are a bunch of variants circulating, and that these have mutations. We have ones from the US, from California, India, Nigeria, some that were recognized in the Philippines. We have the P1 that we're talking about here, that arose in Brazil but was seen also in Japan, and it's unclear whether it came to us through directly through Brazil or through Japan, or very likely from inter-provincial travel in Canada. We have the B117 UK and the South African, but we also have the P2, which is another strain that is causing a lot of illness in Brazil, and it's slightly different from the P1 that we're seeing here. So what we can tell is there's a whole landscape of these different viruses and different variants that we're following, and we see that some of them can really take off. Usually one strain will outcompete the others at any one period of time, and for us right now, that is the UK strain. And it is now found, the B117 is being found all over BC, in much smaller numbers outside of the Lower Mainland, but it certainly is being found everywhere. The P1, which I talked about, Brazil and Japan strain, was introduced more recently. We didn't see it in the earlier screens that we were doing. We had one contained cluster in February in Vancouver, but then we had several different introductions in Vancouver and in Whistler, probably in mid to late February. And these ones had several different chains of transmission. So it wasn't one single cluster or super spreader event. It was many different chains in the many chains that were happening in and around Whistler, as we know. We were doing a lot of testing, and there was a lot of transmission happening in young people and people who were visitors to Whistler as well. And it is likely, through contact tracing, it was likely that visitors from other parts of Canada initially introduced that strain, but then it started to circulate in some of the chains of transmission in Whistler as well, between workers, visitors, and from there spread to other parts of the province. And we Lower Mainland and other parts of BC. So a high percentage of the P1 that we've identified in our province through our screening program is associated with Whistler or travel to Whistler. but it is still a small percentage of all of the cases in Whistler overall, and a small percentage of the cases in Canada. And we think that this peaked about the week of March 22nd. Most of the cases have been identified, and it's through the good work of our public health teams around the province that they've identified the cases and contacts, and we're stopping those chains of transmission. But as we know, that takes time because the incubation period is 14 days, and we are now seeing that people are having a lot more contacts than they were before. We see that in not only the active cases increasing, but the number of people who are in isolation increasing quite dramatically as well. Over the period of much of February and March, we were seeing relatively stable but high numbers in the 500s, but the number of people who were active cases and the number of contacts was relatively stable. And in the last 2 weeks, we've seen both of those go up quite dramatically. Cases have surged and people are having a much higher number of contacts, and that has meant increased numbers of people in hospital, and we know that much of this transmission is happening in younger people. So that means numbers of younger people in hospital has increased, and numbers of younger people needing ICU care has increased, and that is concerning. It is because these variants transmit more easily that we are seeing more people becoming ill in those numbers of contacts that they're having, and proportionally more people requiring hospitalization and, of course, critical care. So we have a pretty good idea about B117, that it is increasing, it is taking over, it's the one that we're seeing most commonly. And we are watching carefully now to see if there's any impact on things like the effectiveness of the vaccine. So far, we are not seeing that, and this is really important. We want to make sure that our vaccine programs are still going to be robust and strong, and one of the important things that we've done from the very beginning is ensure that we can link every single person who's had their vaccine and if they've tested positive for the virus. So that is part of the good work that my colleagues at the BC CDC are doing and that we're watching very carefully. We have not seen any negative effects on our immunization program yet, but of course we will continue to watch that. And we need to use our surveillance resources because we have a limited capacity to do whole genome sequencing, to focus on making sure we can detect if any other new variants that have some different mutation arise in the province as well. And that is part of what we will be focusing on in the coming weeks. So concerningly, much of the increased transmission we're seeing in the last little while is being driven by social gatherings, where people are disregarding our provincial safety precautions for a whole lot of reasons, and we know that. There's no one cluster, one cause. It is happening everywhere, and people may be staying to small numbers, but repeated different small numbers. And it's particularly notable in our younger demographics now, because many young people live, work, and socialize in the same networks. For example, we know a classic, what we have seen many times, is people may work at the ski hill, but share a house or accommodation with 6 or 7 other people. Some of them may work at a restaurant, or at one of the bars, or at one of the retail outlets. And then one of them becomes positive, it spreads to others, and before we know it, it's spread to a number of different workplaces as well. This is a classic spread of chains of transmission that we've been seeing across the province in the last little while. Another example is something we've seen a lot. People decide to have a few friends over to socialize, and then one of the friends has COVID-19 without recognizing it. The next day, they go to a backyard barbecue with a number of different friends, and that drifts into an evening going out socializing. And then, of the 10 people that were there, they go to their workplaces in the next few days, and it gets spread from there. And this is something that is not new. We've seen this in BC, we've seen it around the world. Unnecessary travel and social gatherings are fueling the fire for the variants of concern transmission as well. But we all have the ability to slow that down, and this is a time where we can do that. All of our connections need to be safe connections. We need to have those interactions at a distance, wearing masks, making sure we have small numbers of people and the same numbers of people. I know for many people who have been doing just that here in BC, it has been a very hard and long year, and it is discouraging to see the surge that we're experiencing right now. Let me just say thank you. I know people are doing their best, and we have to deal with what we have right now. We'd all wish it to be different, but we need to deal with what we have in front of us today. The virus is adapting and is taking advantage wherever it can, and it isn't fair. But we are together in this storm, and now we have vaccines on our side as well. There will be an end. Of that, I am confident. And we will be in a very different position by this summer. And that is a prediction that I will make right now. But right now, we do not yet have enough people protected. Those around us, our young people around us, our elders, our seniors, with vaccines to keep our communities safe right now. With every single person that does get a vaccine, we all become a little bit safer, and we will get through this next few months until all of our communities are protected. But right now, if you choose to spend time with anyone other than your immediate household, it must be outside. It must be done safely. It must be small. Let's ensure we don't lose any more ground. We can get through this surge as well. It's the hand that we've been dealt with, and we have to work together to get through it. Let's all pledge to do our part today to break these chains of transmission that we're seeing now. Making exceptions or bending the rules just gives the virus the edge, and nobody needs that right now. So let's stay strong and stay together in this storm by staying apart and remembering that we can do our bit and be kind to each other and being calm and staying